The SF Tech Council advances digital inclusion for older adults and adults with disabilities so all can participate in the city's connected community. In effect, we are a multi-sector initiative. We bring together community-based organizations, local governments, funders, private sector organizations and companies, and academic institutions to solve problems that are bigger than any one of us can do on our own. We are the community table, so to speak, around which all of these organizations come, and you represent them. So thank you again for being here. Today, we are going to take a look at a San Francisco community needs assessment. And what you're going to find out is really hot off the press. In fact, it hasn't hit the press yet. So you are the first, and we've got a couple of folks with us who will be telling us about this survey. I'm going to start out with Debbie Kaplan from the Mayor's Office on Disability so that she can jump in for a few minutes, tell us about why this survey is important and how it included the adults with disabilities in the San Francisco area. And then I will turn it over to Cecile Piritz, who was in charge of bringing many people together in a collaborative way to make sure that this large and very important survey happens. So I'll turn it over to you, Debbie, and then we will move on to Cecile, who's got a slide deck for us that looks pretty exciting.
Thank you very much, Carla. It's a pleasure to be here this afternoon. If we look back on especially the last year and a half or so, the importance of the digital realm has become even more obvious to everybody. The importance of being able to connect with people through technology when we were not able to leave our homes and feeling so much at risk really became more and more obvious that it's just not acceptable for certain people, including seniors and people with disabilities, to not have that ability to take part in economic transactions, in protecting and taking care of their health, and in finding out what's going on during the pandemic, as well as just connecting to family and friends. So, but we all know that people with disabilities and seniors are probably much more likely not to be as connected as others for a variety of reasons. And so MOD sponsors some research that would give us real information about what is the real problem, what are people's actual experiences, what kind of numbers are we looking at in terms of people with disabilities and seniors who experience barriers, what kind of barriers, what's the impact on people, and then what are some potential solutions. Because we can tell people anecdotes and stories, but when you've got research with numbers, you can really affect public policy. This research has just proven to be, I think, a lot more than what we expected. And that's, I think, because of the dedication and creativity of the people who did the research. The numbers of people included in the research for disability research is amazing. And you'll hear about that from Cecile. They created, I think, a new best practice in terms of reaching out to people who are very difficult to connect with, especially because they're not as well connected with technology, and got us some amazing information that hopefully we will all be able to use and point to, and that can become an important marker for conducting really, really good, accessible research regarding people with disabilities. So with that said, just like to turn it over to Cecile. We're so proud of the work that you've done and so pleased that we're going to be able to make use of this. Thank you.
Thank you so much, Debbie, for that amazing and thorough introduction. And thank you so much. It's such a pleasure to be here today, and very exciting because, as Carla just mentioned, this is the first time that we're actually presenting out on these findings. They're no longer preliminary, they're out, well, they're not yet public. So you're actually the first audience, besides our community advisors. And I actually just wanted to name that Jennifer Walsh, who's here in our audience today, was one of our amazing community ambassadors for our project. And I'll be talking a little bit more about their role. So before I launch in, just wanted to share a little bit about myself. My name is Cecile. I've actually worked in the arts and cultural sector for most of my career as a disability community organizer, really at the intersections of accessibility, the arts, and also really interested in public policy. As I think Debbie really mentioned, the importance of research and inclusive, participatory, and disability-centered research. So we really tried to apply that lens to this research, and we hope that it could provide a blueprint for ongoing research and data collection. So quick acknowledgements. So this research was organized through Thriving in Place, under the direction of Rachel Lovett, with major support from the Mayor's Office on Disability. Thank you, Nicole Bond and Debbie, who both were incredible thought partners and drivers of this project. Also to the Department of Disability and Aging Services, DOS, who also provided some funding for this project. So funding for this study was provided through Thriving in Place through a one-time funding grant from City Community Partnerships, with financial support from the National Disability Institute, NDI. And then, as I mentioned, additional funding was provided through the San Francisco Department of Disability and Aging Services. So I'm going to share my PowerPoint in just a moment. But I also just want to kind of acknowledge that this project would absolutely not be possible without the support of the many, many disability community members, older adults, veterans, people who are really on the front lines, who are living the experience of digital inequality. So I really want to kind of center the importance of that, of their role. So I'll be presenting on, we have about 10 key findings. I tried to distill them down to a few less for today. Also, I'll be sharing out some policy recommendations, which we developed in partnership with our community advisors and other stakeholders, a little overview of our demographics, and then some of sort of the major findings. Our final report is currently under review. It should be available, the full PDF report should be available early to mid-September. It'll be available on the Thriving in Place website. I also wanted to make mention that we are providing the full raw data set. So, and I'll mention sort of the purpose behind this, but as you can imagine, we really, there were some limitations and constraints, and we want to make this information public so that to encourage further research on it. So on this first slide, I'm outlining some of our research questions that framed this larger study that we began with. So I'll read them off. So we were, as Carla mentioned and Debbie mentioned, really looking at the technology barriers and unmet needs of San Francisco residents with disabilities, older adults, and multiply marginalized communities that have been most impacted by the digital divide during COVID-19. So really looking at this specific time period. And I just want to clarify what I mean by multiply marginalized communities. Working with individuals who experience multiple forms of oppression. So whether that be due to veteran status, age, race, ethnicity, income, gender, housing status. So looking at people's, lives at those intersections. The second research question, we're looking at what are the links between digital inequality and income, race, ethnicity, disability, age, language, housing, veteran status, and patterns of digital redlining. So really kind of digging deeper into are there correlations that we can find that point to larger patterns that contribute to digital inequality. And then lastly, this points to sort of our recommendations are what are opportunities for targeted and strategic interventions that the city and other community-based organizations or agencies can implement to increase levels of digital connectivity. So the results of this needs assessment are going to be shared with DOS and the Mayor's Office on Disability, MOD, as well as across all city agencies. We're really hoping for this to be used widely and broadly, not only in the city of San Francisco, but also hopefully nationally in other places that are looking to implement this type of inclusive research. So some of our goals were to raise awareness around the technology barriers faced by the disability and aging communities, proposing community-driven policy recommendations, and then, as I mentioned, encouraging more in-depth analysis of data findings using the publicly accessible data set. So now to share a little bit about our methodology. So we were really, really excited to report that we collected a total of 3,080 surveys. The survey was up for about 2 months, from March 21st through the end of May 2021. We took a lot of care in wanting to make sure that this was, the survey was presented in as many different modalities as possible. We had a large print booklet. We designed a phone-based survey. These were available in 6 languages. In person, so we were delivering the printed surveys in person, and I'll mention some of the locations. We also worked with Lighthouse for the Blind to design a Braille survey. And we also worked with urban jazz dance company Access Services to design a American Sign Language vlog, promoting the survey to the deaf and hard of hearing community. So in total, we collected 2,614 digital surveys, which was interesting as well, just to see that the majority was still digital. And then 466 print and phone-based surveys. The majority of our survey respondents identified as older adults, 60 plus, Black, Indigenous people of color, low-income residents, and specifically with representation of veterans, transition-age youth, TAY, and people experiencing homelessness. One of the things that we found is actually 47 to 50% actually were ones that we could validate a San Francisco zip code. So we actually had to narrow down our survey pool, our data pool, to 1,529. What we found, it was interesting, is that there were a lot of folks who completed the surveys across the state, on the East Coast, even people out of the country. So, in one way, it's a smaller data pool, but it's a very, very rich and diverse pool, but also points to how folks across the country are looking to San Francisco for our policies. So the community engagement methodology was so integral to all of our process. Community partnerships, we had over 60 CBO partnerships, and their feedback played such an integral role in all aspects of shaping the survey, the focus group questions, the outreach methods, and also working with trusted community partners. We used a mixed methodology research, so we did both qualitative qualitative focus groups, over 40 one-on-one interviews with community leaders and stakeholders, and then blended that with a quantitative, and that gave us a really nuanced understanding of sort of the bigger picture. Okay. So now this is on this slide, I just wanted to highlight just the different community advisors that worked with us for about 6 months. They were paid community advisors, and we really wanted to ensure a really diverse cross-representation of folks with lived experiences of disability, mental health, veterans. So just some of the organizations we worked with are the Independent Living Resource Center, Community Living Campaign, thank you, Jennifer Walsh, Bayview Senior Services, Self-Help for the Elderly, the Veteran Justice Courts, Deaf Services at San Francisco Public Library, Access SFUSD, which is a transition age program for 18 to 24-year-olds in the district, as well as Mission Neighborhood Center and Shelter Tech, which works to increase digital equity with people who are unhoused or experiencing homelessness. So before I go into our findings, I just wanted to share a really important quote in my mind that sort of frames this research. Many disability community organizers and community members have shared about the importance of remote virtual access even before the pandemic. A lot of these services have historically been denied for people with disabilities. And so here, Sins Invalid, which is a disability justice performance group based in Oakland, shared this quote on their social media. I think it was in March during the pandemic. So it reads, "It shouldn't take a global pandemic to make our culture more accessible to disabled folks. But now that we've seen how beneficial remote, virtual, and accessible options for work, school, healthcare, and social events have been to our communities, let's ensure that they continue. And we need to continue to expand access to technology, which makes remote options possible to BIPOC, low income, and other multiply marginalized disabled people." So just on this slide, really kind of driving in the idea that disabled people and community leaders are not sort of passive recipients of digital technology, that they're actually creators and innovators. So now back to sort of our partnerships. So these are different locations where we work to distribute the survey in food pantries, meal distribution sites, SROs, single room occupancy hotels, primarily focused in the Tenderloin and Soma. We had a lot of responses there. We also worked with the Office of Civic Engagement and Immigration Affairs. They're community ambassadors who do a lot of street outreach. And so they were out in the streets. We also worked with housing organizers to pay people living in supportive housing to set up outreach tables. Senior centers, youth organizations, and then the last point, geographic equity zones. So these are areas where we've historically seen from past needs assessment that have been under-resourced around technology. So our survey was 33 questions. We reached 3,080 people with our survey pool of 1,529. And there were 6 kind of core areas. We looked at access to devices and assistive technology, access to the internet, the various barriers that folks faced, familiarity with or digital literacy, digital skills, access to telehealth, as well as access to services, whether that's food access, information about local COVID response. Okay, so now into our findings. So for our demographics, so here we broke it down by disability, age, income, housing, and I'll go through race, ethnicity. So here by disability, as Debbie was mentioning, we got a lot of rich response. So 26% identified as people with mobility disabilities, close behind chronic pain, 18% deaf and hard of hearing, 17% mental health, and then 16% blind or low vision. In terms of age, we also, I know that the number for transition age youth, 9% is lower, but I also just we really wanted to highlight, a lot of times in research, lower percentages get left out, but every single person counted in this survey. The majority of survey respondents identified as older adults 60 plus and people with disabilities, but we also had a lot of 18 to 24-year-olds. The majority of our survey respondents have a household income less than $20,000. By race ethnicity, as I was mentioning, around 70%, that's 1,126 survey respondents identified as Black, Indigenous, or people of color, with Asian American communities at 38%, white Caucasian, 16%, and then American Indian, Native American, Alaska Native at 14%. So I'm happy to read over these, but this just kind of gives you a range of all of the various communities that we were able to reach and hear from. We also looked at language, since language access really kind of came through as a strong theme. 49% were English, so the majority, but then we broke down by Cantonese, 20% American Sign Language, 10%, 8% Spanish, and then 5% Mandarin. By household residence, so I would probably even advocate to further disaggregate this to look at 88%, either lived in apartment rentals, single family homes, affordable housing, SROs. So I would even, in future research, look even more specifically at this 88%. And then about 5% were experiencing homelessness. And that was through targeted outreach in overnight shelters and navigation centers. And even 69 people is huge in my mind for reaching folks who are very disconnected. And then veterans, we had about 23%. And now by zip code. So the majority we found were in the Western Addition Tenderloin mid-market area. And that makes sense. We did a lot of outreach in those neighborhoods, in the Outer Mission Excelsior, and then continuing down. And also just wanting to mention Visitation Valley. At the bottom, it's 2%, but those 37 people were specifically in partnership with the Samoan Community Development Center, a neighborhood that often doesn't receive a lot of attention and a lot of research. So that was wonderful to see. We also, as I mentioned, conducted focus groups. We have 9 focus groups with 42 participants total. And from a lot of the communities that I mentioned here, older adults, people with disabilities, Tay youth, people living in SROs or experiencing homelessness, adults with disabilities. And so the key findings that I'm going to be presenting on today are actually emerging of both our qualitative and quantitative findings. So one of our first key findings is that access to technology was a vital resource in receiving various services and information, as well as maintaining social connections during the pandemic. So here we found when we asked survey respondents, what services have you not been able to receive but have wanted to access? The top response at 33% was information about COVID response. So this is information that people were not able to receive, 33%. Other unmet needs here revolve around food access at 25%, health information, 23%, and then housing assistance at 26%. And I did want to say that computer and technology training did figure within the top 5 at 23%. And then access to city services, 18%. So continuing along this theme, some of the nuances that we found is that residents living in SROs and experiencing homelessness reported that how vital it was to have access to a device or internet connection in connecting with friends, caseworkers, accessing medication, attending support groups such as AA. And one thing that we heard is that having a device was especially important for checking online systems to reserve 90-day beds in shelter. So someone who doesn't have access to a device or stable internet connection can face very acute barriers to finding housing. For Tay youth experiencing chronic homelessness, we learned this from Larkin, street services, phones were really important in accessing housing and employment services. And then for justice-involved veterans, navigating the court system, right? So a lot of like court dates are done through Zoom, and missing a court date can really impact, or not being able to communicate with a caseworker could have real adverse effects. Also with the deaf community, we found that access to the internet alone does not guarantee access to using a video phone, which is a really important communication method in the deaf hard of hearing community. So for participants, they mentioned the importance of a high-speed internet connection for making video calls, and that oftentimes the internet, low-cost subsidized internet does not function at a speed that is needed to operate a video phone. And of course, these are detailed more in the report. So another key finding is that there are digital challenges that go beyond just access to a device and the internet. So we actually found that 68%, a majority of the survey respondents did have access to a device. But when we look at the device, we actually see that the top percent is for a smartphone. Followed by, so smartphone was 68%, followed by tablet, computer, laptop, and 14% reported no access to a device. And then out of 1,484 respondents that answered this question, how do you access the internet? We found that the majority, 35%, reported that they paid for internet through a broadband internet connection. But then we find that 24% access internet, their primary source is through a public Wi-Fi hotspot. So even though folks have access to internet, I think it's important to note where and how they're accessing it and how stable and reliable it is. And then we found 10% do not have any access to internet. And then we also sort of detailed how many people receive it from their building or a discounted internet. So when we asked survey respondents whether technology was a barrier in receiving needed services or information, we have an overwhelming majority of 64% that said they did. So even though we saw that 10% did not have access to the percentage of people that did have access to internet does not necessarily mean that they did not experience barriers or challenges. So another key finding revolved around, and this again is not new, we've seen this in previous needs assessments, center around affordability, unreliability of internet connection, and concerns around online security. So the majority of people, 28%, said that their internet was too expensive, that was a core barrier. Right below that at 27%, devices were too expensive. And then I just wanted to also kind of point out that 19% could not afford a $10 internet from a subsidized plan. So that's also telling us that for some folks, $10 is a lot. 13% reported language being a major barrier, language access, and we talk more about that in the report. So I'm sorry, I'm kind of breezing through this. It's a lot of information. So now for some information that actually really sort of presented us with some new information, was specifically around telehealth and access to medical services through either phone or video visits. Was both vital, but it also presented a lot of challenges for residents with disabilities and older adults. So when we asked people, have you received telehealth, mental health or healthcare through online or phone, 67% said that they did. So a large majority, close to 1,000 people. But then when we asked people, what challenges do you have in accessing medical services using telehealth? We found that a slight majority, around 20%, reported that it was due to lack of access to a computer, a smartphone, or assistive or adaptive technology. 16% reported needing more training around how to use telehealth. And then when we looked at focus group our focus group data, older adults, many older adults, cited needing more classes and training on Zoom to use telehealth. And then specifically, what was really interesting is that transition age youth also reported having a lot of trouble using online healthcare portals, and that was a barrier for them in accessing healthcare. We actually found that a majority, 57% of people reported missing a medical appointment. So this is just such a critical finding, and really showing that digital inequality is a public health issue, and really needs to be addressed. That specifically receiving telehealth services was particularly difficult for the Latinx community. So there we found that 67% of the overall survey population said yes, they did receive they did conduct telehealth services online. And then we actually found that 50% of respondents whose primary language is Spanish did not. So we found that there actually is more need for training and outreach and support around understand and language access, I think, as well, and providing both digital literacy. That also correlated with digital literacy skills, is that not having a barrier is not having enough digital literacy classes in Spanish. We also heard around Cantonese and Samoan. And the Samoan piece really came up a lot in our one-on-one interviews. So yeah, I hope that answered your question. Sorry, thank you, Anita.
And Cecile, I have a question because I know it's come up in a number of conversations lately. What about mental health services online? Did any of your questions address that question, or separate them out from other medical questions?
Right. Well, so in terms of mental health, we grouped sort of medical and mental health into one when we asked the question, I believe.
Okay.
Right. So we said during the pandemic, receiving medical services through I'd have to go back to the question, but I know we mentioned mental health, but also in our demographic question under the disability question and how people self-identify. I'd have to look back at our demographics, but I think that's another area of looking at the intersections between mental health and telehealth access.
We have one question before we jump back to your information. Sue is wanting to know if people indicated maybe in the focus groups or in the surveys themselves, where did people turn when they needed more tech training or assistance? Did they talk about it? Friends, families? Did they go to a CBO? Who helped them?
Right. So I didn't include it in this slide, but we did find on the survey, we asked a question, do you exactly what you said. It's like, do you have someone who can help you if you have questions? And we did find that the majority of folks did say that they had someone. But what we found quite interesting is in the focus groups, there was a lot of sort of mutual aid sharing, that a lot of people in the SRO, living in SROs or experiencing homelessness, and even the youth, were sharing a lot of resources within the community, within themselves. Mm-hmm. So there wasn't always an organized structure to it. So I think that also points to the importance of building upon community knowledge, those networks. That's one piece. Even with some city agencies, I thought it was interesting when I was asking them, where do you refer community members to? And they weren't sure. So I think when we get to the recommendations, I think even though there is a really robust portfolio of digital inclusion programs in San Francisco, I think that there are still existing gaps, or this research is telling us that there's existing gaps in knowledge, which maybe points to how do we promote those platforms in a way that's reaching people who are not digitally connected. So I'm not sure if that answers.
Yep,
yeah.
Perfect.
Okay.
We'll let you get back to sharing information. Thank you so much.
Yeah, thank you all for those questions. So now looking at key finding around the need for assistive or adaptive technology. So when we asked the survey respondents, Are you familiar with the term assistive technology? We looked at this question by sort of subgroups of people with disabilities. And so we found that a majority of these groups that I'll mention in a moment were unfamiliar with the term assistive technology. So we found that 37% were older adults, so 60 plus. 44% were people experiencing chronic pain or mental health disabilities. So back to your question, Carla, here is a point that we kind of further mined that question. 47% with household income less than 20%. And then just going down, 51% residing in SROs, and then 43% identified as Black, Latinx, Asian American, or Pacific Islander communities. And then also back to Anita's question, 60% whose preferred language is either Cantonese or 38% Spanish were not familiar with the term. So then when we pair that with a question, do you currently use assistive technology like screen readers, braille displays, or accessible apps on your phone? We looked at that same question by selected subgroups by disability. And again, it mirrors these same findings that 60%, I'm sorry, so 60% do not of older adults, 53% people with chronic pain do not. So, or either way we look at it, we could either look at those that do have it or currently do not. But part of what this is pointing, or what it infers to us, is that there is a greater need for more outreach and information and training around assistive and adaptive technology, as well as education on what options are available to people and how people can access repairs. The Independent Living Resource Center has done an amazing job throughout the pandemic at as well as San Francisco Public Library around device lending libraries. But there is a clear need, what we were also hearing from veterans and transition age youth. You know, one of the things that we found is that a lot of transition age youth, when they exit the San Francisco Unified School District, they actually have to return their Chromebook and assistive technology. They can then access it through, you know, the Department of Rehabilitation or other agencies, but that is still a critical time period when people don't have access to AT. So now I believe this is my last key finding that I'll be sharing today, was specifically around digital literacy. And I wanted to share some quotes. I have 3 quotes here that really even speak louder than the data in my mind. So this first quote, I'll read it out. It says, "I don't know what the definition of Wi-Fi or hotspot or computer jargon. I've never seen anything on the news like you're supposed to just know what it means. I feel like I should know, but I don't." So this was a resident in a single room occupancy hotel. This second quote is from an older adult who's a veteran who was actually had just been released from jail after 41 years. "I just got out of prison. I get out into the society. They didn't have phones when I went in. Now everyone's got one. It seems like everyone's completely centered on it and attached to it, and everything revolves on the phone. And here I am. I don't even know how to use the thing." So this is also pointing to the very nuanced experiences of folks who have very little to no access. And also kind of the idea of having a shared vocabulary, that the assumption that everyone knows, which is really not true. So this last point touches on language access. And this is from John Aisha, who's the program director of the Samoan Community Development Center. "Language access is a big issue. That's not equity. What about our Samoan community? We need cultural approaches to be purposeful and strategic in supporting families to feel safe and loved. Everyone needs to be recognized." And this was really pointing to the real lack of translation in Pacific Islander, either in Samoan or Tongan languages, that SCDC was really advocating for more language access. kind of the purpose in sharing with you as well is also inviting you all to be a soundboard for any sort of gaps or areas or recommendations. These again, we have about 8 recommendations that we kind of broke up into short-term and long-term, but I'm providing you with some bullet points here. So the first recommendation is, continuing to prioritize improving free or low-cost digital connectivity for residents with disabilities, older adults, and other multiply marginalized communities. So specifically, what we heard from a lot of the continuing to fund the installation of free Wi-Fi and public computer labs in affordable housing, supportive housing, shelters, and senior centers. I don't know what percentage of affordable housing and SROs currently have free Wi-Fi and computer labs, but there can definitely be an increase in that. And I think that that's such an important way to reach people. Working in partnership with San Francisco Public Library to expand the distribution of free Wi-Fi hotspots and working with them to identify how to distribute them. Another area sort of within this recommendation is sort of auditing and reassessing a map of the free public Wi-Fi hotspots in San Francisco. A lot of people in our focus groups were not aware of how to log on or were concerned around online safety of the unsecured network. So I think really kind of developing a campaign around how to sort of amplify information and education around those hotspots. Setting up free and publicly accessible charging stations and lock boxes was something that came up a lot. Is that, for people who are unhoused or, marginally housed, having access to charging stations. We heard a lot of stories of people, setting up charging stations, in just difficult situations. And then long-term, this is kind of supporting, I think the Digital Equity Strategic Plan 2019-24 really advocated around deploying free fiber optic infrastructure. So really thinking about it as a larger citywide infrastructural utility. And in the meantime, maybe putting in certain steps to help work in that direction. This second recommendation points to the need for greater access to information and awareness around existing digital inclusion programs, information about free or low-cost internet options, and assistive technology and training. So this first point was directly from our focus groups, is advocating for a centralized directory of all of our digital inclusion assets and resources. A lot of folks were like, they're all over, and how do we access them? Designing a user-friendly tip sheet that can be printed and distributed, so not only relying on internet online to disseminate that information, and then partnering with 311, SF City Guide, or Ask Our Cell, which are community sort of online directories. Okay. Developing pipelines to increase funding and distribution of free or low-cost assistive technology, devices, repairs, and training. So really focusing in on developing a strategic plan to increase funding around this, and making sure that AT is available in public technology labs, not just at the public library, not just at Independent Living Center, but across all. Another piece was trainings, making sure that service providers and CBOs have an increased need of the awareness of the digital needs of people with disabilities, as well as ensuring that their digital services and programs are accessible for people who rely on AT. And then after this one, I'll take a break and open it up for comment. So recommendation 4 is increase digital accessibility standards for remote services, programs, and events across the city and county of San Francisco. So one strategy would be to create an accessibility technology playbook, which would provide a framework for improving the delivery of accessible information and communication technology across the city. So this would be a playbook specifically around accessibility and digital access. I also wanted to acknowledge Tiffany, who's here, who also made this proposition in one of our previous meetings around creating an access fund for supporting CBOs in making their online events and services more accessible. A lot of organizations are like, but we don't have a budget line for access. So really piloting initiatives where we're really modeling that is an essential part of ADA compliance that needs to be honored and followed. And then again, training, in-service training for CBOs. Would it be helpful for me to go through the last three and then we could open up for discussion? Thoughts? Yeah.
Sure, that's great. Keep going,
Okay.
and then we'll. I've got a couple things that are coming in, so go ahead.
Okay, awesome. So number 5 is invest in digital equity programs and community-led solutions for transition age youth with disabilities, youth experiencing chronic homelessness, and youth in the foster care system. So we know that there are certain populations who are within disability communities who are acutely impacted. And who often, it would be great to develop a plan to build a citywide digital equity program that's specifically geared towards increasing digital equity for TAY youth with disabilities. Working in partnership with the Unified School District to ensure that TAY youth with IEPs and 504 plans can retain their Chromebooks and assistive technology after they graduate or exit the system, the Unified School District. And then lastly, really important, and this I would probably say for every one of these recs, is to leverage partnerships with organizations that are working to strengthen tech education pipelines for under-resourced youth. So, I think partnerships are essential to all of these recommendations. 6, develop digital stewardship models to include community members with disabilities and older adults in the designing, building, and evaluating of all digital equity solutions for the Digital Equity Strategic Plan. Sorry, I made a mistake there, 2019-24. So one of the things with this needs assessment was how important the community advisors were. And so we really feel like that can carry over into creating and formalizing a disability and aging task force. I mean, another name, but really made up of a diverse cross section of people with disabilities who are advising and leading on those solutions. And then another sort of long-term plan will be to think about developing a paid digital navigator training and employment programs that would work in partnership with residents of SROs, affordable housing, and various community members in helping to provide person-centered information and referral around the digital inclusion process. So thinking about models like the OSEA, Office of Community Engagement, community ambassadors, other models that are currently working in the city that are paying people. So really, so a digital navigator training program. The National Digital Inclusion Alliance has a training on how to put together such a program. So there are a lot of resources and toolkits out there. And then I have 2 more. This one is around piloting initiatives aimed at lowering barriers to telehealth in partnership with affordable and supportive housing to equip residents with internet access, telehealth tools, and digital literacy skills. So here we detail a couple of points around how do we kind of use this really critical data around telehealth and start putting it into motion and thinking about piloting some initiatives in San Francisco. And then lastly, boosting investment in digital literacy programs with a particular focus on language access, accessibility, and cultural relevance. What we found in a lot of the focus groups is just the importance of having trusted community leaders who speak your language to facilitate. So maybe increasing bilingual community outreach ambassadors who are leading those trainings. Another suggestion was to use platforms such as SFGov TV to develop a digital literacy training in multiple languages. In the survey, we actually found that a lot of people, when asked what types of technology, TV was one of them. So thinking also about utilizing platforms that maybe are a little bit more democratic, that people are on public television, to pilot some trainings. Okay, so that is it. It's a lot. Thank you for, I usually don't like talking at and being more interactive, but hopefully this gives you all a sense of this incredible work and how we want to make this public so more people can really use it and put it into action. And we really hope that this can impact some policy.